So the family members yelling, like, yeah, I could have been at work all day, and why am I here if you guys can't get this together? And I'm sure you need the bed. Like all the things.
Because it sounds like it's maybe happened before. I think you got a good track.
A little bit.
Are back with yet another compelling episode of Beyond the Bedside.
Hi.
With me, Betty Long, and
Rebecca Rivkin-Czarkowski.
Welcome back. This is a long-standing topic among nurses and doctors and healthcare providers. I want to say explosive reactions from families, mostly, not from patients, because typically they're often sick or not able to have an explosive reaction. But mostly families and patients. And why it's on my mind is that in the last couple of weeks we've had a couple of cases here.
We have.
That have really stood out. And last night I was talking to a dear friend, old friend, who's been a nurse 40 years as well. And she was on the phone with a patient, and she's known this patient for many years. And he started to curse at her and yell at her for no reason. She was there to help him. And she stopped and said, "Who do you think you're talking to?" She did not use profanity. She just said, "Who do you think you're talking to?" And he continued to yell at her, berate her, and use profanity. And she said, "I'm hanging up." So she hung up. And I said to her, "Do you think 30 years ago, when you worked in the OR and a surgeon likely berated you or threw an instrument across the room at you, something
like that,
do you think that you would have responded the way you did with this case?" And she said, "No." She didn't even hesitate. She said, "No, I have much more confidence now, and I am not tolerating that kind of behavior."
Did she end up speaking to him again?
He wanted to call her, and he went around to the other nurse, and she said, "You might want to wait till next week." He's like, because he wanted to apologize.
Oh, okay, good.
Right, he did feel bad, but in that moment, that has happened a couple times here with our cases.
I know.
And we understand as nurses and doctors and all providers that things happen to people that are scary and tragic, and family's response or even the patient's response is because they're angry, they're scared.
Right.
So we understand that. But in the context of someone just yelling at you and using profanity, it is a form of verbal abuse. And I appreciated the fact that she was like, "Okay, who do you think you're talking to?" And I feel like I'm running on a little bit, but there was another incident when, back in my career at hospital, there was a physician who kind of teed off on me. I forget the circumstances, but I do remember the interaction. And I just stopped talking. I did not respond. I just stopped talking, and I said, "I need you to stop yelling at me.
Oh, good for you.
I need you to stop yelling at me, or we're not going to have this conversation, and I'm going to walk away." And it was a female physician, and it kind of like shook her and said, okay. Like it just, so what I've learned over the years, particularly as a nursing supervisor, and this was a very helpful thing, if someone's reaction is over the top and the situation doesn't really warrant that, it's likely they're not reacting to the situation. They're reacting to something totally different.
Absolutely.
And that really helped me as a nursing supervisor.
To put it into perspective.
Well, to go in and when the families, again, if the doctors aren't telling them what's happening with their loved one or something bad happened, and they're yelling at me or angry at me, I understood that.
Yeah.
I get it, right? There's a reason they're angry, right? But then if the circumstances didn't really warrant an outburst, I was like, okay, this isn't really about what's happening now. this is about something maybe that happened at work earlier today and they're taking it out on me. And I was able to manage that. It helped me understand the dynamic of what was happening. But again, that I was a mature nurse.
I was going to say we were career change nurses too. So we did come with a little bit of built-in confidence just in the work field, right?
Right.
No matter what industry you were in, if you did it as a second career, sometimes you come a little packaged with some.
Right. I mean, have you had instances where you felt like, whoa, what's happening?
So,
because you worked in the ER.
Yes.
Which is
I have always, I'm not a projector, right? So if I hear something, see something, I'm having a conversation, somebody's irate, I try to always like almost think to myself, like, is it something that I did, or is this something, to your point, coming from somewhere else? Mm-hmm. Because once you put it into perspective, there is usually a driver, whether it's a patient and a family member or a colleague, because you know what it's like when you work a full day and maybe your day is a little sad. Something happened that is not the outcome that you were hoping for. It's people's lives, right? As much as the patient and family or caregiver is reactive because it's frustrating and they're waiting or they're not getting communication is, right, as we always say, the key. It's usually a lack of communication. Right. When you have a clinician, a nurse, patient tech or a physician, and there might be a bad outcome or a bad case or something you can't fix. I mean, we are fixers, right? So when you think you can make someone better or you can't, it weighs on you. And so sometimes it is just you're in the line of a fire. But
you know what's sad is, as we said, you have 23 years, I have 40 years. A friend is a chief nurse, and it's still happening, right? She's still dealing with this with her nurses who are in their 20s.
Yes.
And maybe don't have the wherewithal or the confidence to say, I'm not going to tolerate this behavior.
Or maybe they're like, I'm not going to tolerate, like, I'm out. Like, leave rather than deal with it and learn how to manage those situations that are going to happen in your life all the time. But you know, the generation is work to live, don't live to work, which is a little different than previous generations. Right. So I do think there that we run the risk of alienating people who are educated and trained and ready to go into the workforce because they don't think life is worth having to manage that behavior.
Nobody wants to get yelled at.
Right.
Right. But like when you think about like in context of, say, a surgeon in the OR, right? It's a high stress, high pressure situation, right? And if somebody doesn't do their job or hand them the right instrument, right? And they yell. Okay, well, all right. Like
it happens.
It happens.
Absolutely.
Right. But then to continue to berate the person, is whether who it's a nurse, whether it's a tech, somebody, it's like, whoa, time out. That's not appropriate. Like,
correct.
And what's frustrating is that, as my friend said, it's still happening. Like with all the attention being brought to communication, to perhaps training physicians and nurses, like we're still doing it. And is that because it's a stressful environment?
I'm sure part of it is, but because it's like a pressure cooker.
Right.
Even outpatient, you know, you're waiting. This happened to me the other day. I'm in the waiting room. And they take me back on time. They do my vitals. Everything's good. I go into the room, and then I'm waiting in the room with the door shut for an hour and 45 minutes for somebody to come in. I open the door, like maybe if they walk by and see me. And, you know, I pride myself in being calm. So I didn't, you know, is anybody coming? Yes, they'll be there soon. They got caught up in another room. But nobody came in proactively and said, do you want to go back out and wait? Because I would prefer to go out and wait because I feel freer. I don't like being in a confined space, like, you know. So yeah, nobody communicates. And so if you're a fiery person, that would make you mad, right? Think about road rage. People go berserko.
Right.
When you're like, I'm sorry, it just turned green. And they're, and you're like, ah. You know, I think that's the same feeling that I used to get when people would flip out in an ER. That was exactly the feeling that I would get. Like, relax, I'm trying my best to get this done, but it's usually the communication.
Yeah, and that's always been the number one problem as far as I'm concerned.
So let me ask you this. You're a nurse on the floor and a family member goes nuts. How do you de-escalate them? Escalate that as a nurse?
Is it my patient? I need a little more.
A little background. So you have a patient who is waiting for discharge and the family came at 11 o'clock to bring patient home for whatever reason. Who knows who told them 11? And now it's 3 o'clock and we are no closer to a discharge than we were at 8 o'clock in the morning, even though everybody knew since the night before that the patient's going home. That is a very common,
right?
And you're so anxious to get out. Okay. So the family members yelling like, I could have been at work all day and why am I here if you guys can't get this together? And I'm sure you need the bed. Like all the things.
Because it sounds like it's maybe happened before. I think you got a good track.
A little bit.
Good. So if it was my patient or even if I was the nursing supervisor, I would come up and say, Ms. Czarkowski, I'm so sorry. What's going on? And you would say, it's happened. I'm waiting 4 hours for that thing. I'm really sorry. I'm really sorry. Like my experience as a nursing supervisor was that I said I'm sorry a lot. And that was okay because that was my job. Because things weren't going well or
the way they expected
them. And what I said was, I'm really sorry. Let me help. What's going on? Oh, we're waiting for discharge orders. Let me page the resident again, right? Because I was someone in my role as a supervisor who got stuff done, right? So I took responsibility to make sure that we got some answer, some resolution, something, because that was my job, right?
Yes.
If I was a staff nurse, I mean, depending on how, I guess, mature I was or confident, because I think a lot of younger staff nurses avoid it, right? So, I know it's been 4 hours. I'm not going to go in. Maybe they'll...
It's like when I used to work in a restaurant, and if there was a delay, like you deliver all the food except for one entree, and the kitchen's trying to make it really quick because something got messed up, I would just sit in the kitchen and wait for the food and not go out and see anyone else. I didn't want anyone to yell at me. That's not the way to handle it, but I was younger then, and that's what... Right, staying away is not the way to handle it. Right. Just acknowledging that it's happening takes away a lot of like the uncertainty, like, did you forget about me?
Right.
Because that feels that way. You taught me something early in my tenure here by asking, like, understanding what you can do to help. How can I help? What would help you? Like, that's kind of how you can surmise the outcome or the goal, because when you say, how can I help you, and really try and understand what would rectify or clear up or calm the situation, sometimes it comes back, nothing. Make them go faster, which then becomes like thoughtful. Do you have control of that?
Right.
Because that's a piece of it too. What do we have control of and what don't we have control of? The first step is admitting you have no control. And I always say that in every aspect of our lives, know what I can advocate for you. We can try and move this along. I'm a big believer in the night before discharge. I used to let people, when we were holding patients and we knew they were going home, right? Letting them know while you were anticipating discharge and they told you it should be in the morning, just know it could be at 3 o'clock in the afternoon also. And then you remove it. Then there's no, give them the truth.
Correct.
It's not their fault. They don't know. They really don't know. They got to get all the different specialists to put in discharge orders. Right. And by the time you get everything in, it could be 3 or 4 hours. But guess who's left dealing with it? Us.
Yep. Which then becomes a potentially abusive situation where patients or families are teeing off on you because, to your point, they took off from work to get their family member home. You can understand when you sit back and look at it, you can understand it.
Of course.
But if we were more diligent and more aware of communication, speaking
Clear on
straight,
expectations.
speaking straight, and getting people teed up. I think we may minimize some
Absolutely.
of the
'Cause
explosives.
when you're waiting in an ER to be seen, sometimes 36 hours, it helps when we come out of the back of the ER and let people know what's going on. You know, we currently have 17 people holding in a hallway. We're waiting for some beds upstairs. Your labs are working. We did as much as we could to work you up to make sure everybody is safe. People like to know what's going on.
Yes, especially in an ER. I mean, I remember when we were in Seattle last year.
Mm-hmm.
We just sat there, and I kept going up like, "What's going on? What's happening? When are we getting the CAT scan? When are
Me again.
when are we? You know, you just wanted to know, just to have some. Not like we were going to leave,
Right.
but we just wanted to know. So I think that's really, if there's any message in terms of explosive situations, I think it's really asking if you're not getting the information that you need, to ask, right? Not necessarily aggressively.
No.
But just to ask.
I
You know,
need
I'm
to
really
speak
trying
with
to
someone.
understand what's happening. Right. And if you have a healthcare provider or some other staff member being cantankerous
Good.
or aggressive with you, remember they may have other stuff going on as well, right? So everybody's on the same page,
Yeah.
right?
You're on the
Everybody's
same team.
Yeah,
Oh!
everybody's on the same team.
Boop. Jinx.
Nice. Boom. So the takeaway is communicate, right? Both from a healthcare provider perspective, whether you're at the clerk at the desk, whether you're the ER triage nurse, whether you're the patient, the family member. Let's try to talk, right?
Always ask, how long is the wait? How long do you think? It's fine, just so you know. Bring a charger, bring your med list.
We're back to the ER.
It all roads back to the ER, sorry. Well, that was a good, I appreciate that, Betty. I hope that this helps everybody a little bit.
Yeah.
Make everyone's life a little easier.
Because things are heightened in our world, for sure, in our country.
Yeah.
And that's going to trickle into healthcare.
Yes.
As it's trickled into restaurants, retail. So let's just try to be kind.
Kindness.
Okay.
Thanks.
Thanks for watching.
Bye.
See you next time.